Anyway, hello everybody. I will speak through the mic, but those of you in the room who know me will know that I really don't need one. I've got quite a loud voice. So I'm Haylis Smith. I'm the National Delivery Lead for the Suicide Prevention Strategy and Action Plan in Scotland. I'm here today, I guess, to give you a bit of an overview of what the strategy is, what we're trying to achieve, how we're trying to do it, and ultimately what that means for communities and community-led organisations. Those of you who've had the misfortune of already being in a workshop with me today will have to listen to me drone on again, I'm sorry. So our strategy in Scotland is called Creating Hope Together, and it was developed following almost a year of engagement with individuals and organisations across the country. I've heard folk talk about lived experience already today, and that will be a theme that you'll see throughout my presentation. We met with about 700 individuals, and about 60% of them said that they had lived or living experience of suicide. So we were pretty confident that when we came to writing the strategy and action plan, what we were putting in it was going to address the needs of the people that we'd met with and who were having thoughts of suicide or supporting people who had thoughts of suicide. I think it's a rare thing that Scottish Government and COSLA, because it's a joint strategy, publish a strategy that nobody criticises. And so far, and it was published in September 2022, nobody's criticised it. So I think that's really down to the way that we developed it with that wide engagement. So I learned recently how to do QR codes. And by the time I created this presentation yesterday, I thought I've gone a bit QR code mad. But they all take you to things, all right? So the top one's the actual strategy, which is a 10-year strategy, okay? So long-term plan for what we're going to do to try and tackle suicide in Scotland. To go alongside that, we published a 3-year action plan, and there will be another 3-year action plan published next year. So we will refresh the action plan every 3 years throughout that 10-year period, okay? You get to see how we're doing, because we publish an annual report every year. So I'm in the middle of tidying up year 2's annual report, but our first year annual report is available online as well. And that is really mapping against our annual delivery plan. So we set milestones and actions for every year, and that annual report is just a reflection of how well we've done. So the vision in our strategy is to reduce the number of suicide deaths in Scotland whilst tackling the inequalities that contribute to suicide. And we've already seen a few graphs and a few pictures up on our screens today about the disproportionate or the inequalities between those who live in our lower SIMD areas compared to those who live in the least deprived areas. I always think deprivation's a funny word, because I know if you go into those areas and you talk about deprivation, they don't feel they're deprived. So I absolutely, it doesn't always sit comfortably with me. But we know there are inequalities in suicide. We know that 3 times as many men as women die by suicide. We know that you're almost 3 times as likely to die from suicide if you live in the most deprived areas than if you live in the least deprived areas, okay? So we know that there are inequalities throughout. And I guess we want to do what we can to help address those inequalities with a suicide prevention lens on that work. I can't fix poverty. I've got £2.6 million worth of budget to deliver our whole strategy and action plan. I think we can all agree that that's never going to fix poverty in Scotland. But what we can do is work with those communities and help our understanding of what their needs are, and then do something about them. Okay. So we know that to achieve that vision of reducing deaths whilst tackling those inequalities, we need people to come together across different sectors to work collaboratively and in partnership so that our communities become safe, compassionate, inclusive and free of stigma. So our aim is that any child, young person or adult who has thoughts of taking their own life or who's affected by suicide gets the help that they need and feels a sense of hope. And that word hope was one of the key things that came up time and time again as we did our engagement. People needing a sense of hope was so important in the work that we're doing to prevent suicide. So we have an outcomes-focused strategy. There are 4 high-level outcomes that we hope our work will contribute towards achieving by the end of our 10-year strategy. So number 1 is the environment that we live in promotes conditions which help protect against suicide risk. And I've heard a couple of times the words today that this thing is everyone's business. And we have the same mantra for suicide prevention as well. So we want there to be a kind of whole of government, whole society approach that helps prevent suicide in Scotland. Outcome 2 is that our communities have an understanding of suicide, the risks that are associated with suicide and how to prevent it. Outcome 3 is around ensuring that we have the right things in place so that everybody who is affected by suicide gets high quality, compassionate, appropriate and timely support. And outcome 4, and for anybody in the room who's a pure outcomes purist will realise that's not a pure outcome. Yeah, I can see those. But we thought it was really important that we had some way of measuring and recording how we were doing this, and that this work was well planned, well delivered through collaboration with national, local and sectoral partners. Okay, so it was really important to us that that was a kind of processy outcome that was included. So those are our 4 high-level outcomes. We have 7 guiding principles. It's not a maths test, all right? You won't get tested on this at the end. But we have 7 guiding principles, which are really, these were the things that people said. It's really important these are threaded through all your work. Okay, so that we are not just doing things in isolation, but there's kind of key things that drive our work forward. So making sure that we are addressing inequalities and issues around diversity is throughout all of our work. So we are always thinking, how do we take an inequalities lens to this? How do we make sure that those who are most marginalised are included in this work? We have a lived and living experience panel who are a group of individuals who have either had their own suicidal thoughts or have attempted suicide, or who support people who have attempted suicide or who have been bereaved by suicide. And that group are our kind of go-to group, if you like. They're not the only people with lived and living experience that we engage with, but they're our kind of core group. They provide advice and guidance and direction on everything we do, from how we design it, how we develop it, how we deliver it. They are key to that work. We also have a youth advisory group and a participation network, which is made up of around 50 organisations who work with children and young people. And they are they perform that same function for all our work that's around children and young people. So again, we do nothing around working children and young people without that group being involved and guiding and directing our work. We provide opportunities for people across sectors at local and national level to come together. We have events, we have webinars, and at the end there's another QR code you can scan and it'll tell you how to find out more about them. Because it's really important. We can't do everything at a national level. I'm not even going to begin to pretend that we can. It's really important that everybody who's working across Scotland, involved in whatever work that might contribute to reducing suicide, feels they have a place in Suicide Prevention Scotland. So we make sure that we have opportunities for people to do that. We have our time-space compassion principles threaded throughout all of our work to support people's well-being and recovery. And if you missed my wonderful workshop with my colleague Barry earlier, well, you know, you missed a treat. Those that were there will tell you how wonderful it was. But within your packs, you'll see there's an A4 sheet that's got some of the details about our time-space compassion work with more QR codes. What did we do before then? That you can have a look at some of that work, and I would actively encourage you to do that because that's really key to providing support across sectors. We've done a lot of work with CME to look at stigma and discrimination and have been working with them to make sure that that's threaded throughout our work. And we've done an awful lot of work to build the evidence through evaluation and data and research, and we're really fortunate that the Suicide Behaviour Research Lab, which is based in this building, run by Professor Rory O'Connor, have created an academic advisory group, and we can go to them. We have really easy access to research that helps shape the work too. So we have practice-based evidence, we have academic evidence, we have lived and living experience, and we have data, and we do nothing without having those four things in place to help shape the work. So how are we doing it? That purple blob up there is me. It's the best I've ever looked. It says National Delivery Lead. Working alongside me, because I kind of think I'm like the patchwork quilt maker. I sew all the bits together, make sure they look like a quilt. And I see Barry laughing there because he knows sometimes it looks less like a quilt and more like a sock or something. Working to help me deliver all of this work, we have strategic outcome leads. And I guess this was putting into practice that approach of bringing people together to collaborate across sectors. So we have Samaritans who lead the work on Outcome 1, that whole of government and society work. We have Sam H, Scottish Action for Mental Health, leading the work on Outcome 2 around communities' understanding about suicide. We have Penumbra and Barry, my colleague, is in the room here, and Change Mental Health, who work together on Outcome 3, which is around making sure people get the support when they need it. And then Public Health Scotland, who lead on the work around Outcome 4, around data and evidence. We also have a number of other delivery and implementation leads, so people in other organisations. We have CREWS, we have Scottish Recovery Network. I'm not going to even begin to reel them off the top of my head. We have delivery leads in COSLA and Scottish Government who all focus on specific actions in the action plan and drive forward that work with the support of the outcome leads. In every local area in Scotland, we have a local suicide prevention lead. And if you don't know who yours is, then come and speak to me and we'll make sure that you can get connected in with them, because there is work happening right across our country to, I guess, localise that national action plan. And then we have our wider suicide prevention community, and that's all of you. Okay, if you've got an interest in, or you're doing any work that's remotely connected to making people feel nice, you're working in suicide prevention, okay? And we want you to feel part of Suicide Prevention Scotland. And I'll tell you how you can do that with a QR code in a minute. You can see round about that, we've got our lived and living experience and our academic and practice evidence as I've described them. And as I said, jointly, this strategy is owned by government and Scottish Government and COSLA, who work together on this, and that in itself is a miracle. So, you know, I think it's really important that there's the recognition that national and local government have come together to make this a reality. We also have our National Suicide Prevention Advisory Group. Some of you might know Brendan Rooney from Healthy and Happy, which is why I'm here, so you can blame him if this is rubbish. He sits on our advisory group, and along with a number of other organisations whose work focuses on inequalities. So we have Peter Kelly from the Poverty Alliance, we have Louise Hunter from Who Cares Scotland, and a number of other people that I can't remember off the top of my head. And they provide us with advice on kind of strategic directions, but they also advise COSLA and Scottish Government to make sure that we are still constantly taking account of those inequalities and how we can address them. Speed. So, these are the key actions under each of the outcomes. And in total, there are 30 actions and 71 different policy commitments that we're leading on. And I'll just remind you again, a £2.6 million budget. It's not a lot of money when you start to spread it across all of those things, which is why it's even more important that everybody feels like it's their business and helps us. We have work across whole of government and society, looking at how we address access to means, particularly around hanging, poisoning and locations of concern, and work through Samaritan's media reporting to change how the media report on suicide, because it has a massive impact on how on suicide rates when it's done badly. Under outcome 2, we've got campaign, social movement and addressing stigma. So we're about to launch our first national campaign in the middle of April. So you will see that more visibly, incredibly powerful campaign driven by our lived and living experience panel, and 4 members of that panel share their stories in that campaign. We have work around learning resources, whole school and curriculum resources. We will also, at the same time as the campaign goes live, launch our website, which will be suicideprevention.scot. Don't search it now, it won't come up. But in the middle of April, it will. And that will have resources for people who are thinking about suicide, people who are supporting people who've been thinking about suicide, people who've been bereaved by suicide, and people who are working in suicide prevention. So there will be resources for everybody there, a single place where you can go find the information you need, regardless of what your situation is. We're working hard to make make information that's accessible to everybody, that's culturally sensitive, and that supports people in seeking help. Outcome 3's got a whole shed load of stuff. It didn't actually fit in one box, so I had to really summarise. Sorry, Barry, I know that means I've missed some of your really important work out. But thinking about how we address the needs of our communities through things like peer support, through making sure that family and carers have the right access to information, and that we have the right supports in place for children and young people, adults and older adults. So we're working across clinical settings and primary care, unscheduled care and mental health. We're also working to look at or to have bereavement support across the country, because that's an increased risk for people who've been bereaved by suicide and then dying by suicide. And finally, outcome 4, lots of work happening around action plans in high-risk settings, which includes care experience and prison settings and homelessness settings. Guidance around clusters and locations of concern, and improving the recording and reporting of deaths by suicide, and reviews that help us understand what the contributing factors are to people dying by suicide in Scotland. More QR codes. So what does this mean for communities and community organisations? I guess you can see there's a whole range of work. Your phone's going to be going, where do I go? Yeah. A whole range of work that we are working with community, working in communities, working with organisations who work in communities to try and deliver. How do you find out about it? Well, I would suggest this is your go-to QR code. We have a regular newsletter that goes out, and it also has details of all the events that we are offering, access to our suicide prevention network, where we run numerous webinars and sessions on the strategy, and it's also a way of contributing to what we're going to do next. If you want to learn more about suicide prevention and what you can do to support people who are having thoughts of suicide, that code will take you to our Ask, Tell, Respond resources. They are our informed and skilled level resources. Many of you will also know about Assist and suicide intervention skills training, and that is also available, but it's not available on that QR code because I couldn't work out how to do that. So we can give you the access to Public Health Scotland's email address, who coordinate those training courses. Finally, for your QR code anyway, the time, space, compassion information is in your pack, but that QR code will take you to the guidance and the approach around time, space, compassion. And if you're not familiar with it, I would encourage you to go and have a look. There's some really excellent podcasts that you can have a listen to while you're out walking the dog. There's one specifically around communities that you might find of interest as well. I've talked already that we're launching the campaign and website in the middle of April. So, you know, next time when I come back, it's a repeat gig, isn't it? Yeah. We'll be able to show you some more of that. We've also been doing some work with SCDC around community-led action research, where we've been working with 4 different organisations this year, and we hope to have the outputs of that in September, round about September. But we are also now beginning to think about future opportunities for that, thinking really closely around those inequalities that we want to focus on more strongly, and so there will be opportunities for that potentially in the future. So keep your eyes peeled for that. If you get the newsletter, you'll maybe see it. Ta-da! Any questions? I feel like I've just gone, bruh, a whole load of information at you. No? Oh, go, Hannah.
Are there any resources? Thank you. I think we probably all know that there's a function for community at, you know, a kind of grassroots level for supporting people who are maybe contemplating suicide. And I just wondered, you mentioned that there's resources on your website specifically for people who are thinking about suicide and their families and things, but I was wondering if there was anything more kind of aimed towards the general community at all.
Yeah. So our initial approach will be for people who are helping somebody who is having thoughts of suicide. And that information, there will be stuff that's relevant regardless of whether you're a mum, daughter, father, brother, friend, or next door neighbour, or just some random person in the community that knows the person. Because it's all the same. It will also signpost into where there is other support and services, so we're creating a services directory as part of that website. And I know we've had many discussions around Alice and other directories that already exist, but it was felt there was something really needed that would specifically direct people to organisations who could support with suicide. So there will be information there. And I guess what I would say is once the website is up and running, if there's stuff that there will be a sort of let us know if there's anything missing email address. Just have a look. If you don't see what you're looking for, then let us know and we'll look at adding it.
On the training side of things, I remember several years ago there was the Scottish NHS Education for Scotland did there's a mental health first aid courses. Is there anything kind of like whether that's been effective for kind of suicide prevention? Whether it's something that, I mean, in terms of if we were planning to kind of look at training programs to be able to deliver to the community and stuff like that, would that be something that would be supported by kind of evidence as an effective thing to be doing?
Okay. Right. What we've been really rubbish at doing, I've worked in suicide prevention in Scotland since 2004 when the Choose Life strategy was first published. I'm that old, yeah, I know, I don't look it. We've been really rubbish at evaluating anything we've done and measuring the impact of it, and that includes the training. However, the programmes like Assist and Mental Health First Aid are evidence-based. We know that they build confidence in people to intervene. And I think what we recognise though is there's a need for, so that confidence drops off. So if you're somebody, if you've done that training, you leave with the confidence, unless you're using it regularly, it starts to drop off. So it's something that you need to maintain your skills. And I think some of the Ask, Tell, Respond resources that you get through that QR code are a way of kind of just refreshing some of that, as well as repeatedly doing the training course. So yes, there is evidence there, but just not Scottish evidence yet.
I'm just interested in how information flows back and forth, obviously via the portal, fantastic, but the local suicide prevention leads, is there somebody within each local authority, or how does that work and how do we find that out?
So every local authority area has an identified lead. Some of them are based within the local authorities, some within the HSEP, some within the NHS, some within the third sector. So you can imagine how easy that is to find out who they are. But we have a list. So I'm happy if anybody wants to contact me, we can put you in contact with your local lead. We have regular meetings with us. I meet with them every month. An online meeting, they come online, we have a conversation about what's happening and what they're doing and how we can support them. We also have 3 staff based within Public Health Scotland who we call implementation support leads, and we've split the country up into 3, and they work closely with the local leads in each of the areas that they have a responsibility for. So we've got a good sort of feedback loop. We know what's happening in those areas, and they know what's happening nationally as well, so that we can respond to things as they are required. But yeah, just if there's any questions, just drop me an email, get in touch. Duncan, you going to challenge me?
It's just to say our service doesn't obviously say we're suicide prevention, but because of the gravity of the issues we deal with, suicide is almost a byproduct of the trauma they experience. And also in the courts, we've challenged the courts on this as well,
Yeah.
at Dorothy Baines level, about re-traumatisation, and there's no bookend support, there's a bit. So services like us who don't class ourselves, have nowhere to share that data. We've maybe done 8 to 10 major suicide interventions. So it's trying to find an avenue for that across, although you're not classed as a suicide prevention charity.
Yeah, and it's one of the areas of work. So I talked a bit about the data around suicide deaths. One of the things that I guess is the next step in that, Duncan, is thinking about how we better record suicide attempts, because obviously we want to get in before those suicide attempts become a suicide death. But also that very thing, how do we get information about where interventions have happened? And I think there's a bit of a recognition that that's not going to be through the NHS or local authority data, that it's often happening across community-based organisations and the third sector. So we've brought in a system called QES to capture the information about suicide deaths more effectively. And we've got 9 local authority areas who are testing that out just now. When it comes to the suicide attempts and the interventions, what we're probably going to be looking at is testing that similar system out, because they've got a same one but for attempts with some third sector organisations. And it's likely that the information will go out through our newsletter around that. So again, that's probably something to keep your eyes peeled for. You going to take the mic out of my hand now, John?